Hi, my name is NSG, and today I'll be demonstrating my injection skill. So first, I'm going to knock, perform hand hygiene. I'm going to don clean gloves, and while I'm in the patient's room, I'll be practicing GPSP and the 11 nights of med administration, and I've already done my 3 checks. Hi, my name is Anastasia. Can I get your name and date of birth, please?
Williamson, 8/24/06.
Alright, that is correct against what you said. That's correct against the medication order, so we're all good. Alright, do you have any allergies?
No.
Alrighty. Before administering any medication, I'll be doing the proper assessment. Alright, the first medication that I'm going to be administering for you would be your first dose of the SubQ test. So the sites for that are the inner aspect of the forearm, right in this area, and then the upper back and the subscapular region. Alright. An intradermal injection, the needle gauge is 25 to 27 mLs. Sorry, 25 to 27. And then the needle length is 0.25 to 0.50 of an inch. You would administer no more than 0.5 mLs in an intradermal injection at a 5 to 15 degree angle. So I've cleaned the site from in to out with an alcohol pad, and I'm going to make sure I insert this needle bevel side up. I'm going to go in at a 5 degree angle, inject my medication, pull the needle out at the same length. I would make sure to instruct the patient not to massage the area. I would engage my safety and dispose of it in a proper sharps container, but for educational purposes, I'm recapping my needle. Alright. So I would come back after the appropriate amount of time and evaluate the response. So my next injection will be subcutaneous, which I would put on clean gloves. And the sites for this injection are the outer aspect of the arm and the tricep. You could also do this one subscapular in the upper back. Alright. You can do it on the anterior aspect of the thigh, through here, in the umbilical region, from the iliac crest to the costal margin, avoiding the umbilical area, but in the abdomen, on the upper side preferably. If you don't mind standing for me. Alright, turn to the side. Alright, another location you could do it is the dorsal gluteal area, and then the ventral gluteal area, which I'm going to demonstrate on how to find. You're going to put your hand on the greater trochanter, palpate the iliac crests, keeping this finger perpendicular to the anterior posterior iliac spine. You're going to inject right here in this V, the upper portion of this V. Alright, so the needle gauges for a subcutaneous would be 25 to 30. The needle length is 3/8 to a 1/2 inch, most commonly 3/8 to 5/8. And this would be no more than 3 mLs. Alright, so I'm going to clean the site with the alcohol prep pad from in to out. Take this off. And you can inject this at a 45 to a 90 degree angle, which I am going to do a 45 degree angle. I'm going to insert it, hold it with my non-dominant hand, slowly administer the medication, and then I'm going to withdraw the needle at the same angle I put it in at. I would engage my safety, dispose of it in the proper sharp container, but for educational purposes, I'm going to recap it. And then you would take a Band-Aid and put it over the site. Alright. So the last site is the intramuscular site, which has 3 locations. The first one is on the bicep. You're going to go 3 fingers down in the acromial process, and inject it right in this V. The next one is going to be at the vastus lateralis, which if you separate the thigh into 3 this way and then 3 this way, it'd be right here in this square. All right, and the last one, if you don't mind to stand for me and turn to your side, is going to be the ventriculateral area, which I'll demonstrate again. You're going to put your hand on the great trochanter, palpate the iliac crest, keeping this finger lined up with the anterior posterior iliac spine, and you are going to inject right here in this V. Alright. The needle gauges for intramuscular is 20 to 25. The needle length is 5/8 of an inch to 1.5 inches, and you would administer no more than 3 mLs. You would insert this at a 90-degree angle, like a dart, perpendicular to the body. You're going to clean from inwards to outwards with an alcohol prep pad. And there's 2 ways to administer the medication effectively. The way I'm going to be demonstrating is a Z-track method. So you're going to take your 2 fingers, pull up on the skin, holding the needle with your dominant hand. You're going to put it straight in like a dart. You're going to grab what you can and then administer the medication over the allotted time. Leave the needle inserted for 10 seconds. Withdraw at the same angle. Engage your safety. Well, first you'd let go of the skin. Engage your safety, dispose of it in the proper sharp container. For educational purposes, I will be recapping. And then you're going to put on a needle, a Band-Aid. And I'm gonna dispose of my gloves, perform hand hygiene, come back after the appropriate amount of time and reevaluate in response to the medications. Immediately document. And